Hello, good afternoon, Rosberg. I am Mihiraa. Let's begin your warm-up session. What motivated you to pursue a career in medicine?
My passion for helping others, and making a positive impact on people's lives, has always been the driving force behind my decision to pursue a career in medicine. From a young age, I was drawn to the idea of using my knowledge and skills to improve the health and well-being of others. Medicine provides me with the opportunity to do just that, allowing me to combine my love for science with my desire to make a difference in the lives of my patients.
How do you approach patient care and communication?
Patient care and communication are at the heart of my practice. I believe in establishing open and honest communication with my patients, taking the time to listen to their concerns, and fully understanding their medical history and goals. I strive to empower my patients by providing them with the information and resources they need to make informed decisions about their health. I also prioritize compassion and empathy in my interactions with patients, ensuring that they feel heard, respected, and supported throughout their healthcare journey.
How do you handle difficult or challenging patients, especially those who may be uncooperative or resistant to treatment?
Dealing with difficult or challenging patients requires patience, empathy, and effective communication skills. I strive to approach these situations with compassion and understanding, taking the time to listen to the patient's concerns and address any underlying fears or anxieties they may have. I work collaboratively with the patient to develop a treatment plan that takes their preferences and values into account, while also emphasizing the importance of adherence to medical recommendations. Building trust and rapport with the patient is key, and I remain committed to supporting them throughout their healthcare journey, even in the face of challenges.
Can you discuss a time when you had to deliver difficult news to a patient or their family? How did you handle the situation?
Delivering difficult news to patients or their families is never easy, but it's an essential aspect of compassionate care. I recall a situation where I had to inform a patient about a serious medical diagnosis. I approached the conversation with empathy and sensitivity, ensuring that the patient felt supported and understood throughout the discussion. I provided clear and honest information about the diagnosis, its implications, and the available treatment options, while also offering emotional support and reassurance. I encouraged the patient to ask questions and express their feelings, and I made myself available to address any concerns or uncertainties they may have had. By providing compassionate and patient-centered care, I aim to help the patient and their family navigate this challenging time with dignity and respect.
How do you prioritize patient safety and minimize medical errors in your practice?
Patient safety is paramount in healthcare, and I take numerous measures to ensure the well-being of my patients and minimize the risk of medical errors. This includes thorough documentation of patient information, careful verification of medications and treatment plans, and adherence to evidence-based guidelines and protocols. I also encourage open communication among healthcare team members to facilitate effective collaboration and prevent misunderstandings. Additionally, I actively engage patients in their care by educating them about their conditions and involving them in decision-making processes. By promoting a culture of safety and continuous improvement, I strive to create a safe and supportive environment for my patients and colleagues alike. You can now start the role play. Good morning, Mihiraa. How have you been feeling lately?
Well, doctor, I've been feeling a bit off lately. My blood pressure has been excellent since I started taking aspirin 3 months ago, but I've been experiencing some stomach pains and feeling quite lethargic and irritable.
I see. It's good to hear that your blood pressure has been under control. However, those symptoms are concerning. Have you made any changes to your medication or lifestyle recently?
No, not really. I've just been faithfully taking my aspirin every day as prescribed.
Mihiraa, I understand that you've been experiencing some discomfort lately, and it's important for us to address it together. Sometimes, medications, even those as commonly used as aspirin, can have side effects that affect different parts of our body. In your case, it's possible that the aspirin might be causing some irritation to the lining of your stomach, which could be leading to the symptoms you've been experiencing. To help alleviate your discomfort and determine if the aspirin is indeed the culprit, I'd like to suggest a trial period without it. This will allow us to see if your symptoms improve once we remove this possible trigger. Additionally, I'll prescribe some antacid medication and proton pump inhibitors to help soothe your stomach during this time. These medications can help reduce any inflammation or irritation in your stomach lining, providing you with relief while we monitor your progress.
But doctor, if I stop taking the aspirin, how will I keep my blood pressure down?
Mihiraa, I want to assure you that managing your blood pressure doesn't solely rely on aspirin. While aspirin can be helpful in certain cases, it's not the only solution, especially considering your current health status. There are many other effective ways we can work together to keep your blood pressure under control. One of the key approaches is through lifestyle modifications. By incorporating regular exercise into your routine, maintaining a healthy diet that's low in sodium, and finding healthy ways to manage stress, we can make significant strides in managing your blood pressure. These changes not only benefit your blood pressure but also contribute to your overall health and well-being. It's important to note that aspirin isn't necessary for you because you don't have any cardiovascular disease, diabetes, or renal issues. You're already in good health in those aspects, which means we can focus more on preventive measures and lifestyle adjustments rather than relying solely on medication. I'm here to support you in making these lifestyle changes and ensuring that you feel confident and empowered in managing your blood pressure. Together, we'll create a personalized plan that suits your needs and helps you achieve your health goals.
I suppose you're right, doctor. But what if it's not the aspirin causing my symptoms? What if it's something more serious, like stomach cancer?
I completely understand your worries, Mihiraa. It's completely natural to be concerned about your health, especially when you're experiencing symptoms that are causing you discomfort. However, I want to reassure you that while we take your concerns seriously, it's highly unlikely that your symptoms are indicative of something as serious as stomach cancer. Many times, symptoms like stomach pains and discomfort can be attributed to more common and less severe conditions, such as gastritis or ulcers, which can often be managed with appropriate treatment. However, if your symptoms persist even after we've taken steps to address them by stopping the aspirin and providing medication to soothe your stomach, it may be prudent for us to explore further. In such cases, we may consider performing a gastroscopy, a procedure that allows us to closely examine the lining of your stomach to rule out any serious conditions. This would provide us with a clearer understanding of what might be causing your symptoms and help us determine the best course of action moving forward. Please know that your well-being is our utmost priority, and we'll do everything we can to ensure that you receive the care and attention you deserve. If you have any further questions or concerns, please don't hesitate to let me know. We're in this together, and I'm here to support you every step of the way.
All right, doctor. I'll trust your judgment and follow your recommendations. Thank you for your help.
You're welcome, Mihiraa. Let's work together to get to the bottom of this and ensure you're feeling your best.